Thank you, Dr. Olfeich, for the invitation. It's quite an honor to be here. And thank you, Mr. Schwab, who is really the driving force of a lot of these activities here. So today I'm going to be talking about mainly the new work that I've been involved in the past 2 years or so, focus on the strength-based model of neurodiversity and how we are practicing this model in the Stanford Neurodiversity Project. I'll first give an introduction to neurodiversity and then talk about the strengths-based model of neurodiversity, and then the Neurodiversity Project, and then finally open up some opportunities for everyone to consider. So what is neurodiversity? According to some experts before me, they define neurodiversity as a concept of really thinking about the behaviors and brain function of all the people that have differences as part of the normal variation of the human race. So I think most of us have seen the bell-shaped curve. The bell-shaped curve has the green area where most people are, and that's considered average. And then the yellow part on the right-hand side would be people that are 1 standard deviation above. And the people that are on the left-hand side, but yellow, they are 1 standard deviation below the average. And people that are on the red, that means they are in the far extreme. They are really, really well above average or well below average. So when we are thinking about IQ, that's how we define IQ. So IQ of 100 would be average, and someone that have IQ of 115 would be really high. And 130 is kind of like almost genius, and some people even have 145 like Einstein. And people with intellectual disability would have like IQ of 70 or below. So, but IQ is only one aspect of how, or one assessment that we use to determine how good a person is in terms of the cognitive function. There are many other functions that are really not included in the typical IQ test. So this person, Howard Gardner at Harvard University, has put forth a theory of multiple intelligences. So basically what it is that we have people that have musical abilities. They really understand the rhythm in their brain. They are very good at visual spatial function. There are some people that are very good at verbal linguistic, and some people are very good at logical, mathematical, and some people are very good at bodily, kinesthetic. And some people are very good at interpersonal and intrapersonal abilities. So basically, we can think of, like, for example, Einstein can have some kind of profile that I'm going to show you the arrows that I think he may be having. So in terms of the first one, musical, he is actually quite musical. He played the violin. And visual spatial, he really can imagine a lot of things in his head without really any assistance. So he is really way ahead of everyone. And verbal linguistic, he's kind of okay when he was a child. When he was 5 years old, he started talking. So he's kind of behind for several years early. But as an adult, he definitely had no problem. So logical, mathematical, clearly, he's the all-time genius. So we don't know exactly where he is, but we're all the way to the right. And intrapersonal, not as good. Interpersonal, maybe even a little bit lower. Bodily, kinesthetic, probably average. So a genius can have some really big challenges in some areas, but not all areas. And if someone is able to, like Einstein, be able to really think about what can be focused on and really go with it, then you can really change the world. So, well, Jay Leno is another neurodiverse person. I think he openly told people about his dyslexia. And I would say musical, maybe average, visual, spatial, average. Verbal linguistics, probably way above average. And logical, mathematical, average. Interpersonal, I think is up there. Interpersonal, up there, and bodily kinesthetic, probably average. But basically, the idea here is that there can be, we can consider neurodiversity as a competitive advantage if you are able to find where the strengths a person has. So, so the neurodiverse conditions that we are thinking about are autism, dyslexia, and ADHD most of the time, but there are also other neurodiverse conditions that we also think about. So for the sake of time, we are going to be focusing more on these three conditions, and more so for dyslexia. But you can see also that in the autism population, there's about 1.7%, which is not rare anymore. That means it's like 1 in 59, like 1 every couple of classrooms. You can find someone with autism. Dyslexia is very high, 13, 14%. I think earlier on, early speakers were saying 15%. ADHD, 5 to 7%. So considering that a lot of these people with disabilities, they generally cannot really get a job, or their employment is much lower than others who do not have disabilities, it will be really wonderful if we can turn their abilities into something that is very useful for them. So that's why we consider the strength-based model of neurodiversity, and is very different from the disability model. So the disability model really has all the medical background of defining what the deficits might be, and because we can find the deficits, we'll have the target to try to normalize that particular function. But sometimes we miss out the boat by not thinking about all the other things that are really going to be helping each person, like the entrepreneur spirit, creativity, visual, spatial thinking, hyper-focus, attention to details, deep interest in particular topics. So the first few, the top 3 especially, are more for dyslexia. And for the next 3, more for autism, and maybe this 1, 2 for autism. And determination, we see a lot of individuals that are neurodiverse that are quite determined, more so than others. So when we are thinking about the practice, so I'm a psychiatrist, so I think about what I'm taught, or what I was taught when I was in training, and how I think it's going to be practice with positive psychiatry. So assessment, traditional psychiatry would focus on the pathology. The positive psychiatry would be more about the positive attributes and strengths. Research focus more so for risk factors, pathology, for traditional practice. But if we practice positive psychiatry, it would be more like thinking about neuroplasticity, protective factors. In terms of treatment, traditionally, we would think about how to relieve the symptom, but positive psychiatry would say maybe we can increase the well-being and growth. And treatments, I do a lot of pharmacology in my practice and short-term psychotherapies, but positive psychiatry really is about psychoeducational and trying to enhance the positive attributes. And we are thinking like positive psychiatry is going to be more helpful for preventative kind of treatment, which is largely ignored in traditional psychiatry. So talking about dyslexia, we know the common challenges of dyslexia are reading, writing, spelling difficulties, time awareness, rote memory. But there are common strains like Dr. Tempini was talking about the creativity and the visual spatial function. They are generally very good problem solvers and synthesizers, and they are very good observant and very good socially. Sometimes I like to use this acronym, MIND strains. Dr. Olfish introduced this acronym to me. So M stands for material reasoning, I, interconnected reasoning, N is narrative reasoning, and D is dynamic reasoning. In the case of autism, the common challenges of perseveration can be actually a strength depending on the context. So it can be considered as a persistence. And seeing big picture is usually a big problem for individuals on the spectrum, but because of that, they really get into the details more so than anybody else. And sometimes if the problem requires the detail, you have the right person. So field interests of individuals on the spectrum translate into very deep fund of knowledge. And the perspective-taking problem, sometimes the other flip side of it is that these people, when they are your friend, they are really concrete and honest, and they are very loyal people. So the next thing is ADHD. Common challenges are the definition of ADHD, and common strengths are the multitasking, creativity, entrepreneurial spirit, and they are quite resilient. So to practice the strength-based model of neurodiversity, we consider two components. The first is the positive psychology part, and the other part is about the development, the opportunities to help with development. And we also want to focus on stressing that these neurodiverse conditions are conditions rather than disorder. And we want to not forget about the challenges, but we call them challenges instead of deficits. And we want to apply this strength-based model broadly. So what is positive psychology? These two people, Martin Seligman from University of Pennsylvania and Jackson Mehayi, who was in University of Chicago as department chair of psychology department for many years, later on went to Claremont. They basically first talked about positive psychology just about 20 years ago. And this paper has been cited more than 16,000 times. So what they think is that the core of positive psychology would be well-being, the contentment and satisfaction, and flow and happiness, as well as hope and optimism. Because of such a good vibe from positive psychology, that many people have published and practiced positive psychology, and there are 53 published definitions of positive psychology. So it's difficult to really keep up exactly what the definition may be, but there are basically 3 themes that are most popular according to these 53 published definitions. And the first is virtues, character strengths, positive personality traits and related attributes and abilities and talents. The second is phenomena indicative of happiness, positive emotional well-being, subjective sense of fulfillment and satisfaction with the quality of life. And the third is more developmental, is developmental process of becoming strong, growth, fulfillment of capacities, actualization of potential and development of the highest authentic self. So when I was thinking about how we are really shaping our programs at Stanford with positive psychology in mind. I thought I have to pick something, some kind of definition, but it's really hard to pick. So basically what I'm thinking is always everything about these three themes. So anything that's really good coming out from positive psychology. So how do we conceptualize the use of positive psychology in individuals with neurodiverse conditions? So the first thing that I would think about is to basically design an environment that can raise awareness for personal strengths, increase the trust in personal ability, so to build the self-confidence of the person and help them learn to engage in relationships and also increase the self-satisfaction through success. And on the other hand, for any psychologists in the room, you use cognitive behavioral therapy, and a lot of the time what your goal is really to change we call them automatic thoughts that come to the brain, get the negative ones to become positive. That's basically the goal. So basically that's what we are trying to do for all those comorbid issues like anxiety and depression and executive function or executive dysfunction. So building strengths, utilize interests, positive behavior supports, and the universal design for learning are the tools that we use. The other part of neurodiversity, or the strength-based model of neurodiversity, is the 7 vectors of development posed by Chickering, also developed by a Stanford education professor, Chickering. Harvard. I wish that's Stanford, but this book actually, student mental health. Actually, this book is coming from us. My department chair, Dr. Laura Roberts, was editor of this book, and I was privileged to be writing one of the chapters that talk about how we can practice the Chickering vectors of development. So in terms of the first thing that we are trying to do is to develop competence. And for every single vector, what we are trying to do is to think about what we can help teach students based on that developmental task. And the second thing is what can the school officials do in order to help the students. And the third thing is what can mental health providers do in order to help with developing that particular aspect. So I'm not going to read it all to you, but the concept is that developing competence, managing emotions, moving through autonomy toward interdependence, not only independence, developing mature interpersonal relationships, establishing identity, developing purpose, and developing integrity. Those are the 7 things that we always think about when we develop these programs that I'm going to describe to you in the Stanford Neurodiversity Project. And there are 6 objectives. The first thing is the most important thing. So we want to help students that are neurodiverse, but before they come to Stanford, we want the environment to be ready for them. So basically, we want to establish a culture that treasures the strengths of neurodiverse individuals. And we want to empower these individuals to develop their personal identity so that they can have a really good long-term success in dealing with life. And we want to, if we're doing it right, then we're going to attract the students to come here to Stanford instead of MIT or Harvard. We are already taking them anyways, but we want more of them. And we want to train others to really care about this particular topic on neurodiversity. And we want to disseminate this model eventually, locally and nationally, and basically at the end, we can maximize the potential of neurodiversity, not only for the neurodiverse individuals, but for all of us. So we have a very small team. Dr. Laura Roberts is our executive sponsor. I'm director of the project. Mary Herbert is sitting right there. She's a program manager. Laurie Spur is an adjunct lecturer. She used to be at Yale, and I was able to pull her to our direction. So we are thinking about 4 different major things when we are practicing the model. So the first thing is education, educating the neurodiverse individual as well as the public, and also internally in various departments at Stanford. And we work with service organizations and companies on helping with identifying jobs that may be suitable for individuals that are neurodiverse. And we also have, because I'm a psychiatrist, I provide mental health support. And we collaborate with our legal scholars in the law school for advocacy issues, as well as on paper, I'm 85% researcher, so I'm supposed to be doing research all the time. But NIH does not know that I have 300% of my time, all the time. So Neurodiversity Project has 3 main initiatives. The first is awareness and education. The second is work and wellness. And the third is independent living skills and housing. So this overall effort was actually started from this special interest group for neurodiversity just about a year and a half ago. Initially, we had about 20 staff and faculty members at Stanford wanting to develop something that can help with hiring individuals on the spectrum. And very quickly, it evolves, and it now, so in April last year, so just about a year ago, this, our project that was used to be a grassroots effort. Now it is a formal special initiative in the Department of Psychiatry. And our 20 people now became over 100 people calling in to our monthly meeting to basically listen to usually a speaker. Every month we have someone that talk about a topic of neurodiversity that's helpful for developing employment opportunities or better experience in college. So this is a list of the topics or the titles and the presenters in each of those monthly meetings, and I'm not going to read them out loud, but a lot of topics that are really valuable for us to learn from so that we can build a program that's as best as possible. So the next thing is awareness program. So basically that means I talk to as many groups about neurodiversity as possible, and this is only a small list that's included here. I talk both internally at Stanford as well as outside Stanford. And a few weeks later, I'll be going to Moscow, Russia, to talk about neurodiversity. So the idea is to really spread the word about neurodiversity across campus as well as outside campus. And we like to engage with corporations because they can help identify positions that can be available for neurodiverse individuals. And we are also teaching our students about neurodiversity. So we started a course called Topics in Neurodiversity, Introduction and Efficacy. We talk about dyslexia, ADHD, and autism in various different aspects, so behaviorally, socially, and biologically, and how students at Stanford can think about the efficacy opportunities. So we have, in this quarter, actually, we have our Stanford students mentoring others, high school students in Burlingame High School, and that's a really good experience. So next quarter, we are going to be teaching this topics in neurodiversity, design thinking approaches. So this is the design thinking approach. I'm not going to go over it, but basically this is an iterative process that is very popular in the Silicon Valley that can generate a lot of design ideas. And a lot of this kind of iteration can very effectively get to a very good design, and sometimes generate ideas to form companies. So the next thing is about the seminar series in our Neurodiversity at Work ongoing support program. So we are doing this program for the managers and the rest of the team to help them with working with individuals that are neurodiverse in the transition time after onboarding. And the biggest thing that we are trying to launch sometime, hopefully in the summer, fall timeframe, is this Stanford Neurodiversity Project, Neurodiverse Student Support Program. So we would like to provide support in terms of transition for Stanford incoming freshmen. We would like to provide independent living skill support, social life support, help them with accommodations, learning support, career development, the mental health support. And we are going to have a course that will be covering all different aspects. And what we are planning on doing is to provide a curriculum to train peer mentors to help the students directly. And we have staff from Stanford Neurodiversity Project that will be monitoring. We are forming an affinity group to help with social life, and we collaborate with the Office of Accessible Education for accommodations. We collaborate with Nicole and the rest of the SLC for learning support. We collaborate with the Career Center at Stanford for career development, and I collaborate with the Vaden Health Center for mental health. So basically, we want to have a lot of support from all different angles, and at the end, it's going to be a big team helping with the student. It's kind of like the IEP of in the high school and I mean K through 12, but we're not going to call it an IEP, obviously. But we think that this can provide some students an opportunity to succeed. So the next thing is about the Neurodiversity at Work program. We have we have launched this program recently by helping with facilitating the hiring of an individual on the spectrum to work at Stanford in the School of Medicine. And I'm not going to go over the process in detail, but basically we are helping both the neurodiverse individual as well as the team to find the best match. And we do not use the typical interview process because the typical interview process really doesn't work so well for neurodiverse individuals, and we would like to change that. So that's why we are making a completely different model. So basically, every single employee have a team of support people. So in addition to the team manager, in the work-life support circle, there's the team buddy, there's the Neurodiversity at Work mentor, as well as a job coach and a case coordinator. And the job coach and the case coordinator will also work with the family and person and the counselor if necessary. So I also direct this adult neurodevelopment clinic. So basically, this is a clinic for neurodiverse individuals. with the last couple of minutes, I'm just going to pose this question: how can we work together to maximize the potential of neurodiversity? So if you are interested in neurodiversity, then you can potentially join the special interest group. Just send us an email. Let us know your interest in neurodiversity. Let us know if neurodiverse individuals that you know are looking for employment. If you know any organizations that want to learn about neurodiversity, or if they have jobs, that's even better. Let us know. Tell us how you want to be involved, and by working together, we can make a difference to the neurodiverse community and beyond. This is our website, and this is our summary. We talk about how neurodiverse individuals can offer much to organizations, and how there are specific challenges that can be overcome. And we talk about the Stanford Neurodiversity model and what our project is about. And this is so we cannot really do this without our anonymous donor who gave us some initial funding for a few years, and Mr. and Mrs. Goldman, and our Department of Psychiatry, as well as a lot of the committee members that have been really active in pushing this project forward. Thank you for your attention.